Okay, Caoimhe, you're good to go.
My name is Caoimhe Gleeson, and I'm from the National Office for Human Rights and Equality Policy with the HSE and with the Quality Improvement Division. I'm delighted to welcome you all to the online launch of the explainer video of the Assisted Decision Making Capacity Act 2015. We had planned to have the launch in April of this year, but had to move it to an online launch because of COVID-19. So thank you all, particularly our participants, for your patience with this. Also, due to COVID-19, our CEO, Mr. Paul Reid, is unable to join us in person today, but he's made a recording which we will share with you shortly. Dr. Philip Crowley, who is the National Director of the Quality Improvement Division, is going to join us for the start of the launch, but also because of COVID-19 has to join the NPHET meeting this morning for the remainder of the launch, but he will be here with us for a short time. I'm delighted to say that we've had over 1,100 people sign up for today's webinar, which is fantastic. And I'm not sure how many are with us at the moment. I'm sure Jacqueline will let us know just in a moment about that. So welcome to everybody from all corners of Ireland and those that are joining us from other jurisdictions, including our guests, the Shaler family, who are joining us from Germany today. Before we start, there's a few housekeeping arrangements I need to go through with you. First of all, the webinar will finish at 12 p.m. today. The chat box function is open. You'll see that on the side of your screen. We'll try to help you with technical issues through this function. So there's a number of people that are supporting us today: Jacqueline, Ross, Elaine, Orla and Marie, who will be able to take questions. So when you have technical questions, can you put it in the chat box to all panelists, not just the host? Otherwise, we may not be able to get to you. We also invite you to post comments or feedback throughout the event. I'll try and give mention to some of these if time allows. If you want to change the screen view, you can go to the top right-hand corner of the video screen, and it'll give you a number of options. We'd advise you to use grid view so you'll be able to see other presenters or other people that are going to be on the launch today. If you're having any issues with sound or internet connectivity, we'd advise you to dial into the webinar. The dial-in details will be in the chat box. Sometimes the sound may be cleared, particularly if you're in an area where the broadband isn't great. The launch is being recorded and it'll be made available on assisteddecisionmaking.ie next week. We'd encourage you to share this link with colleagues and friends who may be interested in it. The video that we're going to be showing today is also available on this link as well, and it is available to share as widely as possible. We have been awarded 2 CPD points from the RCPI and 4 CEU points from the Nursing and Midwifery Board. Over the coming days, you will receive an email with your certificate of attendance and details on how to apply for your CPD points in relation to this. All of our guests are joining us virtually, so we may have connectivity issues. Please bear with us in case this happens as we try and resolve those. Also, we'll be showing 2 videos, one from our CEO, Paul Reid, and one about the explainer video. There may be a short delay while we're setting this up, so please bear with us on that. So by way of background, we started working on this explainer video in 2008. Little did we know then how lucky we were to be able to bring such a diverse and rich group of people together to make such a short film about such an important act. We're very grateful to have had this time. We would not be able to do this at this time. And we're all very grateful to those that participated and gave so generously of their time. And you'll be able to see what I'm talking about very shortly. And we'll say more about this later. This morning, we're joined by a number of guests who will share their own perspective on why the Assisted Decision Making Capacity Act 2015 matters to them. And why commencement of this act is so important, including a number of guests who were in the video itself. And we're delighted that they're able to join us today. To start, I'd like to invite Dr. Philip Crowley, who's the National Director of the National Quality Improvement Team, and he's also acting National Co-Lead of the Public Health Response to COVID-19, to give us his opening address. From the moment the Act was passed in late 2015, Philip has ensured that efforts to prepare for commencement were given priority by the HSE. And in the years that have passed, he has continued to fully support the work to enable commencement. This has not been easy, given the continued delays with commencement and more recently pressures from COVID-19 related work. However, Philip remains one of our greatest supporters, and we're very grateful to have his time here today. So thank you, Philip.
Thank you, Caoimhe, and good morning, everybody. Wonderful to see, I guess, the degree to which our citizens and our staff are so supportive of this act by signing in today and learning more about this really, really critical act, the Assisted Decision Making Act, brackets capacity. It's really comes to the core, I think, of how we care for people in our society, how we work with people in our society, and how we engage. It essentially is based on the premise that capacity exists to make any decision on our own lives until proven otherwise. And even when capacity is in any way hampered, that we must put in place every support possible to enable the individual to make the crucial decisions about their own lives. And this video that we're launching today, I think, really brings to life, I think, very, very effectively the importance of this act to our citizens, to our people. I'd really like the Office of Human Rights and Equality Policy in my own team, Caoimhe, Jackie, Mary, Ross have been helping, Orla and Elaine, and also Angela, Carol and Deirdre, who helped prepare the video, because the work they do is sometimes a little bit unsung maybe, but absolutely crucial, and kind of steers, I think, the organisation in the right direction in relation to issues of human rights and equality, things that are really important to me, and I think very important to everybody else who's on this webinar today. So I think when we think about the Act, it's absolutely critical that it is commenced. We have been working away on it to ensure that people are prepared to utilise it effectively to protect the rights and interests of everybody who we deal with in the HSE. And I think it behoves government now to commence this act as quickly as possible, so as we can get on with a more rights-based approach to how we deliver care to our citizens. The video itself, I had a sneak preview of it. It's a really beautiful video, I have to say. It's quite emotional. I'd really like to thank Damien O'Donovan and his mother Mary, Claire Hendrick, the Shaler family, Margaret Sweeney, and others who gave of their time and gave us their insights and their perspectives to really make a very powerful statement in favour both of this act and in favour of effectively implementing it. And we in the Quality Improvement Team and particularly the Office of Human Rights and Equality Policy will be continuing to help, I think, our health services over the coming weeks and months to be really well prepared for the commencement of this act, whenever that happens, and which should be as soon as possible, and to apply it as effectively as possible to protect the rights of our service users and of our citizens. So I'd like to hand you back with that to Caoimhe, and to thank you all for participating in today, and really to reiterate my thanks to the Office of Human Rights and Equality for the wonderful work that they do, and for this video as well. Thank you all very much.
Thank you, Philip. And now we're going to hear from our CEO, Mr. Paul Reid, via a virtual clip, which Ross is going to play for us now. So thank you, Ross. Just give us a moment while Ross sets it up. Okay, and fingers crossed that this will all go well. Thank you.
Good morning, everyone. Unfortunately, I can't join you today, but I did want to send a message to you all at the launch of this important resource for staff. The legislation for assisted decision-making impacts many people who use our health and social care services. It's crucial that we support our patients and the people who use our services to have autonomy when it comes to their care and their treatment. The explainer video is an excellent support tool for staff who will need to know the detail of the Act. I want to take this opportunity to thank the staff, the service users, and volunteers who took the time to take part in the video. It's refreshing to hear about the importance of the Assisted Decision Making Act from a broad range of stakeholders. The core principle of this Act ensures the person receiving care is at the centre of all decisions. I know that we all want to ensure that this becomes part of our culture in health and social care every day. As CEO of the HSE, I'm fully committed to supporting the implementation of the Act. The past few months have shown how important it is to identify the person you want to advocate on your behalf if something happens to affect your decision-making capacity. We're all vulnerable to losing this, and at any time without warning, So the commencement of this Act should be our collective priority. Again, I'd like to wish you all the best with the launch today. I now invite you to sit back and enjoy watching the Assisted Decision Making Explainer video.
So Ross is now going to play the video. So thank you, Ross. We all make decisions, big and small, every day of our lives. Most of us are able to make these decisions by ourselves. There are many people accessing our health services whose ability to make certain decisions about their life and choices may be affected by a disability, an accident, a medical procedure, or a chronic illness, either on a temporary or permanent basis. A new law called the Assisted Decision Making Capacity Act 2015 has been passed, which gives people the right to be assisted to make decisions with legally recognised supports regardless of disability or any condition which may affect their decision-making capacity. The Act is for everyone over the age of 18 who has difficulty now or who might in the future have difficulty making decisions. A number of decisions are covered by the Act, including day-to-day decisions, what to eat and what to wear, through to more complex decisions like whether to buy or sell a house or to have a surgical procedure or what to do with a large sum of money. All services are covered by the Act: banking and financial services, legal services, and health and social care. A number of key features of the Act include: a person has capacity until proved otherwise. A person should be supported to make decisions as far as possible. Information should be provided to a person in a way that is easily accessible. A person has the right to make an unwise decision if they choose to. A person can make an advanced decision about their healthcare treatment, which will apply when she or he can no longer make those decisions. The wards of court system will be abolished and a new system will be put in place. A new body called the Decision Support Service has been set up to oversee the Act and is based in the Mental Health Commission. The Decision Support Service has a number of functions, including public awareness of the Act and supervision of the decision-making support arrangements.
The Act puts me in charge of my life. It means I can get to make decisions when I want it. This Act is great because this is my life and I have the same voice as everyone.
This Act matters to me as Damien's mum because it makes it clear that Damien has the right to make his own decisions, which is really important. It also means that we can get information and advice that he might need to support him in his decision making now and in the future. The Act also provides reassurance for me that when I'm not with Damien, that he'll be able to get appropriate support to make decisions in relation to all aspects of his life, but that his right to make his own decisions will be safeguarded.
I'm currently making my wishes and preferences known to my husband and sons. If I suffer a serious illness or there is an emergency which affects my ability to communicate, my family will know what I would want. And with this knowledge, will be able to support me while at the same time making sure that my rights as a human being are respected.
This new Act encourages us to plan and think ahead, which is so important for us all. The Act will allow me to be legally recognised as Veronica's support person.
The Act allows people to plan ahead and put in place legal binding arrangements about the healthcare treatment they do not want when they no longer have the capacity to make this decision.
This act matters to me because I will be able to support individuals that I work with to make their own choices in life and to be more involved in what happens to them.
This act matters to me as a dentist. It is important that the patients I treat have a full understanding of their dental care and treatment options, and that they are supported and enabled to make decisions in relation to their own oral health.
The acts that matter to me because I won't lose all my rights to make my own decision, which is what can happen if a person is made a wounded court. Even if I can't make my own decisions, the act keeps my wishes and values and beliefs at the centre. There can be no decision about me without me.
Assumptions should not be made about a person's ability to make and communicate decisions based on an initial diagnosis, especially in the case of a severe acquired brain injury, where the condition of the person can improve over time.
Pádraig enjoys life, and a big part of that is being able to make decisions and to let us know what he wants. These decisions range from basic day-to-day decisions, what he wants to eat, what he wants to watch on TV, to more complex decisions about care and treatment. And sometimes Pádraig's decisions surprise us.
I represent public health and community nursing services. We as nurses hold a very privileged position of entering into people's homes and of witnessing the reality of how patients live their lives. Therefore, I wholeheartedly embrace the opportunities that the Act will bring for patients to shape their healthcare decisions. The Act provides an opportunity for patients to have a voice and represents an approach which appreciates the values, needs and preferences of each and every patient. This is achieved when patients are facilitated to become informed decision makers and exercise their choice in a shared decision-making process.
The Act provides legislation for advanced healthcare directives. This is where a statement is made by a person with capacity, setting out his or her will and preferences about medical treatment, which may arise in the future at a time when they no longer have the capacity to make decisions. It will guide the treating doctor to care for the patient in a way that the patient would have wanted, and I believe that will be very helpful in general practice. The area that it will have huge relevance will be transferring persons from nursing homes to acute hospitals who do not have the capacity to say no.
Why this Act matters to me. If my mental health deteriorates, I lack the capacity to make decisions myself. I nominate my husband Pádraig to act on my behalf in carrying out my decisions and wishes if I'm unable to do it myself.
And this Act means that Margaret, the person I love and support, will feel happier and empowered if her wishes are both respected and listened to.
This Act means that the people in my care can be assured that they have the right to access information in a way that can maximise their understanding, and they are to be given more time to understand that information, to help them to make decisions.
The Act recognises that people need formal supporters to help them make decisions. These formal supporters are called interveners. A person can have a number of supporters to assist them with different decisions.
Nothing about me without me.
Nothing about me without me.
Nothing about me without me.
Nothing about Pádraig without Pádraig. Do you agree with that, Pádraig? Yes.
Okay. Thank you for that, Ross. And again, I'd like to thank all of the participants. As you can see, we've many people that contributed their days to participate in the video. If any of you have been involved in filmmaking it, you know that it's not just a couple of moments, it's your full day's work to do that. And we had people from all over the country that contributed, and we're so grateful to have that, and we're so grateful to now to be able to share it with yourselves. So just to note, there was probably a little bit of a delay in lip sync and all of that. That's because we're streaming it. So when you play it with your own teams or play it yourself, it'll be in sync. It's to do with this medium that we're now using. And thankfully, it didn't break down on us today. So thank you. So we're now going to hear from Anya Flynn, who is the Director of the Decision Support Service, which is the body that oversees the Assisted Decision Making Capacity Act 2015. Anya was appointed in 2017 and has the challenging task of establishing the Decision Support Service and bringing our human rights obligations into the 21st century. We're really delighted that Anya is able to join us today. So thank you, Anya.
Okay, and thank you very much. Thanks very much to the HSE team for having me today. I'm really delighted to be here for the launch of this. I think it's going to be an excellent resource, and I must compliment in particular the contributors, the experts by experience who appear in the explainer video. I think it really does make it a very rich tool, and makes the contribution of their personal stories makes it so much more vivid and powerful and moving. So I think I'm going to have the opportunity now to share. I'm hoping that somebody will tell me if that isn't working.
I can't see it, Anya. Typical. Okay, do you want me to share it on your behalf instead then? Would that be easier just for speed?
Okay, it's up on my screen, but if you think that works better, Jacqueline, that's fine.
Yeah, because it's not up on our screens at all. So give me a second and I'll share it on your behalf.
Just in case anyone is joining us on the phone, we're just waiting for Anya's slides to be shared, and we haven't broken down. We just have a slight delay. Anya, you might just chat away there and tell us something about yourself while we're just waiting for that.
Happy to do so, to fill the dead air. Yeah, I know, and just to reiterate how pleased I am, and I must congratulate your team on the production of this video. I think it really will be an excellent resource. And as I had been saying, I think what makes it so powerful and so vivid is the contribution of personal perspectives. I think it makes it all the more meaningful. And as I was saying, all the more emotional, and really does keep, I think, our focus on what we need to do in order to get this act commenced, because it will make such a real contribution to the lives of ordinary people. And there's a considerable number of them who will stand to benefit from the supports which the Act will bring. As I will be, am I good to go?
Yeah, you're good to go.
I'm good to go now.
You're going to have to just tell me when to change slides.
Okay, so yeah, we can go to the first one there then, Jacqueline, thanks very much. Now, I am not seeing that, so are we on the first slide, do we think?
Give me a second, it's not changing slides for me. Hold on a second.
Sure. Would you like me to attempt again to share my screen instead?
I can get power back and see if that's going to work. Hold on.
Okay. Okay. And if I do that, is anything happening for the world at large?
Okay, if you want to try and share it again now.
Okay, I believe that I am, but I'm not sure if you're seeing that.
No, we're not.
Okay, let me try one more time then.
Oh, there we go. That looks like something's happening. Yep, it's working now. Yep.
Oh, that is marvelous. Okay. All right. Best laid plans. Okay, let's go for it. Now, I hope that you're seeing Michael D. Higgins standing beside a Christmas tree. And if you are, then, as I say on this slide, the full title of the Act is it's an Act to provide for the reform of the law relating to persons who require or may require assistance in exercising their decision-making, whether immediately or in the future. As we know, this was signed into law right at the end of 2015, but it isn't yet fully commenced. Estimates, and those of the Department of Justice's estimates, suggest that as many as 200,000 adults could benefit from the new supports under the Act. And that number comprises people who have intellectual disability, acquired brain injury, difficulties arising from mental health conditions, or age-related cognitive impairment. But that isn't for a moment to say that anyone necessarily of those 200,000 plus people necessarily will need to avail of the Act or the new supports. That will depend very much on their personal circumstances or the decisions which they need to make. It's also the case that it is an Act for everyone, in the sense that outside of those 200,000 people, any one of us could, through accident or illness, at a later time in our lives, require these supports. We may have decision-making capacity difficulties of our own. So as the explainer video makes clear, it is in every sense an Act for everyone. And it's inspired very much by the principles of the United Nations Convention on the Rights of Persons with Disabilities. The convention, which was ratified by Ireland in 2015, requires the state to promote, protect and ensure the full and equal enjoyment of all human rights by all persons with disabilities. And disability is broadly defined within the convention. And it mandates that state parties, so Ireland, must recognise that persons with disabilities enjoy legal capacity on an equal basis with others in all aspects of life. As Damien says in the video, he enjoys human rights the same as everyone else. And I don't think that anyone would argue with that. Okay, I think the slide is not changing for me. Sorry, Jacqueline, I don't know if I do need you to take over again. I seem to be stuck here on slide 3 and it isn't moving forward. I don't know if anyone can stage an intervention.
Yeah, I can try and see if I can take over. Give me a second. Unless you're just wanting to talk through it. Is your screen completely frozen at your end as well?
But it has, yeah.
Yeah. Okay.
I think sometimes when there are a large number of people, I think connectivity problems like this can arise.
Anya, I'd suggest maybe just keep going through your slides, and then we can just say to people, so those that are listening, we'll share them afterwards. I think maybe just the essence of what you're saying is critical.
Okay, let me just recover them for myself then for a moment.
And in the meantime, I can try and see if I can get them up for you as well. So.
Okay.
Oh, they're working now.
Is it? Okay. Yep. Yeah, now sometimes this Act has been described as bringing about a big cultural shift, and I think certainly there are some aspects of it which are new and to an extent challenging. We see within the Act that capacity is not based on a medical diagnosis, and certainly in the past, capacity has been seen very much as a medical issue. We also see the abolition of the status that exists in wardship at the moment, this idea of a person of unsound mind. And in the explainer video, Claire Hendrick has spoken about what it meant to her to come within that status finding, where effectively, when she was made a ward of court, all of her decision-making, the independent decision-making that she'd always been able to exercise, kind of devolved away from her. We also have, I think it's important that we dispel this idea of the next of kin myth, as I've heard it referred to. There is a well-established but really unfounded idea that our next of kin have some sort of status as a substitute decision maker, or that somebody in our family is able to step in and supply consent where consent is required. And it can be a surprise to people to learn that that really isn't built on anything at all. And access to the new supports under the Act, we would say, must be a feature of care, so that people who are availing of health and social care services should be entitled to call upon the Act and to put in place the support arrangements which it provides should they require to do so. And then on the other side, providers of care must be amenable to dealing with these new support arrangements and to engaging with these new category decision supporters. But I think it's important not to make too much of this idea of a cultural shift or to say that something very dramatic is coming down the tracks, because in many respects what the Act does is to give effect to principles and an ethos and a whole approach that we should already be following. And there are some things that are put on a statutory basis within the Act which are with us already, like the presumption of capacity and the functional assessment of capacity. They are already the standard and we see them already in policy. Do we always apply a presumption of capacity? I know that the Shaler family and their contribution to the video do make the point it's really important not just to rush to judgment because of somebody's presentation. And I've also heard Damien Donovan's mother Mary say separately that she was aware of a doctor deferring to her and speaking to her in relation to Damien's care on one occasion, rather than engaging directly with Damien himself based on a presumption on how Damien presented. So that shouldn't be the case. And person-centred care and support, as I think we know, is already the gold standard. We should already be involving people in their decision-making as far as possible. Now, I hope that changed there. The Frida principles are sometimes invoked as the proper human rights-based approach in health and social care. And those are the principles of fairness, respect, equality, dignity, and autonomy. Again, very much called out in the Act, but it's the kind of approach that we really should be following already. As the video mentions also, there are different categories of decision, and they are quite broadly defined, which are amenable to the Act. And it's in relation to decisions such as these that new support arrangements could be put in place. So looking at the personal welfare category, for the purposes of today's audience, I suppose, personal welfare is quite broadly defined. Accommodation, education and training, social services and healthcare is in there. And then that really broad catch-all, other matters relating to a person's well-being. So it's in respect of any kind of decisions coming within these two categories that any person could seek to rely on the supports offered by the Act. So thinking then about what is new, and this is where the Act is quite ambitious because it puts in place this new three-tier framework of decision supporters. That term decision supporters, by the way, is one that we have coined. There isn't a term in the Act that means all of these, but it describes these different levels of support which can be made available. And at the lowest tier, as you see there, we have the decision-making assistant, that person who can be appointed by the relevant person. The relevant person, by the way, is a term within the Act, which means the person whose capacity is or may be called into question. So that person can ask for a decision-making assistant to enter into an arrangement so that they can help obtain and explain information and help the relevant person communicate their decision. So the relevant person, herself or himself, is still the decision maker, and that's unarguable. At the middle tier, then, you have co-decision making, where, as the name suggests, decisions are made jointly by way of a registered arrangement. And then at the upper tier, there is still, should it arise, and it should only be as a last resort, there's an opportunity for the court to appoint somebody to be a formal decision-making representative. And that person takes their authority from a court order. So this puts in place formal structures where currently we really often don't have formality. And I know that contributors to the video have mentioned that as well, that this is an opportunity to have certainty where currently we have custom and practice instead. And these arrangements will all be supervised by the service of which I'm director, the Decision Support Service. They have to follow those guiding principles, which you've heard about in the video. And at the heart of those guiding principles, at the heart of UNCRPD, is this idea of giving effect to past and present will and preferences as far as is practicable. And the Act also has important things to say about advanced planning. As we were saying, anybody could, at some point in their lives, lose their decision-making capacity, that ability to understand, weigh up information, to retain it and to communicate what it is that they want to do. So it's really important that we are amenable to planning ahead, and the Act expands our opportunities to do so. Enduring powers of attorney already exist. They've existed at law in Ireland for more than 20 years at this point, and they're somewhat expanded under this Act so that when you have your capacity, you can appoint an attorney who can now also take healthcare decisions on your behalf. Healthcare isn't covered by EPAs as we have them at the moment. And I know that both Margaret and Veronica in their contributions to the video have mentioned that importance and that security that comes with knowing that you can plan ahead and choose somebody you trust who can formally step in to make decisions should you lack the capacity at a future point to do so. And attorneys under the new Act will be subject to new reporting requirements and to supervision, a level of regulation that doesn't exist under current legislation. The other important mechanism for advanced planning in the Act, and again they're mentioned in the video, is the Advanced Healthcare Directive. And the purpose is stated as being to enable persons to be treated according to their will and preference with regard to their treatment choices, and to provide healthcare professionals with information about those treatment choices. And Dr. Billy O'Connell references in the video how important that is, and from the point of view of the providers of treatment. So that a refusal of treatment contained in an AHD is just the same as a refusal made contemporaneously by a person with capacity. So it's an opportunity for you to set out in writing, in a binding instrument, what you want to happen should you lose capacity, so that your voice can really be heard at a future point in respect of those treatment decisions. And there's also an opportunity under the new Act then to appoint somebody called a designated healthcare representative who's able to step in and ensure that your AHD is followed and respected. So a word or two then about the Decision Support Service. It is located in the Mental Health Commission, as you've heard, and I think that's proved to be a very good home for it. The Mental Health Commission has important experience of taking human rights-based legislation and building reforming structures around it, but clearly what the Decision Support Service will do takes the Commission in quite a new direction and is beyond the remit of mental health regulation. Our aim is for an accessible, very much person-centred service. You've heard a bit about what our functions are, and they include promoting awareness and confidence, providing vital information about the Act to the relevant persons and their supporters. We have that regulatory function around registering and supervising the decision support arrangements, and there's a complaints and investigations function. So if those arrangements aren't going well, if there's some concern about those, then we're able to process complaints about those and put things to right. And we have an important job to support organisational change so that relevant persons can exercise their capacity. And I think it's important to say, as I have before, that in a way, in the title of this Act, the brackets are really important. So it's the Assist Decision Making brackets Capacity Act. The Act was going to be called the Mental Capacity Act. And I think it would be wrong to assume that this is a piece of legislation which is just about a new way of assessing capacity or a new tool for accessing consent. As the title of the Act suggests, there is a key focus on supporting people in their autonomous decision making. That should always be the first step to help people participate as far as possible in the decisions that matter to them in their lives. Similarly, the Decision Support Service at one stage was going to be called the Office of Public Guardian, which is what it's called in other jurisdictions. And the feeling was that that was overtly paternalistic, if you like, and that Decision Support Service much better describes its function and its priorities. We also have a piece of work which will be coming up to publish codes of practice, which I think will provide important guidance to health and social care professionals, and to people themselves who are going to have to engage with the Act, the new decision supporters, and there is also to be codes of practice for sectoral use, for example, for legal professions, for financial services professionals, because this Act really does apply across a multitude of sectors and areas of practice. There will be a public consultation, I should say, before those codes of practice are published and finalised. So that is us. The Decision Support Service website launched last month, and I put up the web address there. And in it, you will also find information on the Act and what one can be doing to get ready for when it's rolled out. So thank you very much for your time today. I hope that is of some assistance. And once again, my compliments to the team in the HSE for putting together this video. Great work has been done there, and for being so creative about mobilising this event virtually. And I wish everybody well, and the Decision Support Service is at your service as well if any further queries arise. So thank you very much.
Thank you, Anya, and thank you for setting out all of the work that's taken place even though we don't have full commencement, that doesn't mean that things aren't happening behind the scenes. And I think it's very helpful just to see all of the work that's happening. And we had a question there in terms of when do we expect commencement? So the government have committed to early 2022, but it's contingent on quite a number of things, that the DSS is fully funded, that the court service are ready for the dissolution of wardship. So there's a number of things that have to be put in place, but essentially that is the official commitment from government in relation to commencement. So thank you. Thank you, Anya. Now we're going to move to the contributions from 3 of the groups that participated in the video. And we're going to start with Margaret Sweeney, who joins us from Carlow. As I said, we have a very regional representation. Sorry, no, yep. We've a very good spread of people from all over the country in relation to the participation on the video. So Margaret joins us from County Carlow. She describes herself as an advocate of the recovery model and co-production in mental health. She's recently started work as a recovery education facilitator with the Recovery College in the Southeast. And I'm going to hand you over to Margaret. Hopefully we'll have no sound glitches there. And Jacqueline is on track.
Margaret, can I just check, do you have your phone turned on?
It's probably just a little bit of feedback sometimes between, if you have your computer and your phone on at the same time, there can be feedback. So we'll just get this sorted now and we'll get going.
Okay.
Better?
Yeah.
Yeah. Okay, I'm just going to give you a little synopsis of my story. So bear with me. I'm a bit nervous, so I'll just read down. I just wrote a few notes. I remember in 1981, an enthusiastic, free, fun-loving girl taking a plane to England to start my life at 17 years of age. I was going to change the world. Leaving a warm, lovable, happy home, one of 8 children, my parents encouraged us towards education, travel and fun. I left for England to train as a psychiatric nurse, where I worked hard, partied, socialised, studied. I met Pádraig at 21 years of age, fell in love, got engaged in Paris and got married on my birthday, so we'd have no excuse for forgetting our anniversary. Had 2 children, Pat and Fergus, bought our dream home, had the credit union loan, 2 cars sitting outside the door, the mortgage, living very much as most of my colleagues and friends. After 2 traumatic births, 4 years later at the age of 33, my life was to change totally. At 33 years of age, I had my first psychotic episode. During this time and for the next 8 years of my life was to be paralysed by mental illness, spiraling out of control, and during this time I was at risk of losing my children, my husband, my home, all my colleagues, friends and family. I was diagnosed during this time as a persecuted paranoid psychotic schizophrenic. I lost my job and had financial problems. My journey took me to police stations, women's refuges, homeless B&Bs, solicitor's office, courtrooms, and eventually a bedsit attached to the side of a house. I left the hospital the last time 15 years ago, where I couldn't even afford a pack of cigarettes. But something else happened during that last admission. I met a lovely psychiatrist who put down the pen and treated me like a human being, not a diagnosis. And Pádraig, who I thought I was a burden on, cried one night that he needed me. I went home from the hospital and started to take notes of my life. I couldn't even clean, wash, cook, clean my toilets. The house was in disarray with Pádraig trying to work with my 2 small kids, with no family support. I reached out to a neighbour called Mary, who had used the services for 6 months. She became my sole peer support. Here I rocked, shocked and talked, and over many cigarettes, most of my problems seemed to abate. Mary accepted me non-judgmentally, and through this friendship I learned how to rear my teenage children, clean my toilets, cook, iron a shirt, I somehow began to trust the world again and looked outward instead of inward. According to my nurses, I was maintaining well, but after meeting a little nurse called Claire Fitzpatrick 5 years ago, I realised I wasn't just maintaining, I was recovering from trauma in my life. After attending services for 23 years, where all I was offered was OPDs and medication, I became frustrated with this approach. I discussed these frustrations with this nurse, who was supporting me in my home at the time as my CPN. Not only did she listen to me, but she started me on a journey where I was to learn about myself and my mental health in a whole different way. She did this through choice, education, and opportunity. She also accepted me not as a diagnosis, but as a person. And this sense of acceptance followed throughout the next 5 years. For the first time in years, I felt I wasn't somebody's job. She made me feel I was a capable, strong woman, and this made me change the way I looked at myself. And I started taking healthy risks with my life. She showed genuine care for my thoughts, opinions, and aspirations. There was a real honesty about the relationship, and I began to feel worthy of this care and trust. I began to feel a sense of empowerment. She didn't at any level treat me like I was fragile, incompetent, or incapable. And this made me feel very valued and respected. Getting to know this nurse and the whole RE team has enhanced my recovery enormously. My husband and myself are back on track in our dream home. Both my children have achieved third-level education and have permanent jobs. I won a community award for volunteering for my service. My medication has been reduced. Life couldn't be better. And sometimes I feel like that young girl who took the plane in 1981. I feel free and in control of mental illness. I have a great sense of empowerment. What the Assisted Decision Making Act provides me with a legal framework. If I lack capacity and when unwell, to nominate a person of my own choosing to support me in making decisions, and more importantly, to ensure that these decisions are followed through. It also means that at other times during periods of being unwell, I will be assumed to have capacity and be supported in making choices and decisions for myself. These decisions are law-abiding and must be adhered to. Example, if I had to sell my house. To go insane, to lose your grip in reality is, from my experience, one of the most frightening, painful, terrifying experiences you could have in life. To be able to even make the simplest decision, full of fear and anxiety, and for the most part alone and isolated, is very challenging. My mind has not always been my best friend. However, to presume that a person with a mental health diagnosis is capable of making decisions and choices for themselves during these periods of unwellness is inaccurate, and this needs to change. Not to live a life of your choosing and not to have control over making life choices, which is a human right in a free world, can have a disabling effect on the individual and slow down recovery. Recovery is a deeply personal and unique process. The Advanced Decision Making Act will put the power back in my hands, where I can choose and make decisions for myself, by myself. The Assisted Decision Making Act will support me to develop personal plans with a nominated person in the event I lack capacity. Realising for myself what supports I need in life, through recovery education and advice from peers and care providers. As I have to live with certain constraints due to the effect of my mental health challenge, I've built up a trusting relationship with my team and I feel more in control of my life. I don't know the path my mental health will take in the future, but I feel with this act I will have a sense of control over how and where I'm treated, and at present have the mental capacity to put tools in place to make me secure and confident about the future. My recovery journey, as I was saying, started 7 years ago when I was given the opportunity to get involved in different recovery initiatives in my area nationally, such as setting up involvement centres, working in co-production and opening of the Recovery College South East. During this time, my confidence and personality improved. I changed the way I viewed myself. I wasn't just a person with a diagnosis of persecuted paranoid psychotic schizophrenia. I view myself now as a valued member of my mental health service. I've been recently employed as a recovery education facilitator. And through this recovery path, I don't struggle as much as I used to with my mental health. I have real trusting relationships in my life. I've expanded my social network, and my standing in my neighbourhood and community has been re-established. And through my work, I get to do something so purposeful and meaningful as to educate and connect with others on the recovery journey. Not one cap fits all, but I only can stress the importance of choice in a person's life, so they can decide what's important to them and what makes a difference. I now feel I've got a grasp on my mental health. My mental health shaped a part of my life. It doesn't define me. Recovery is challenging, but life is meant to be challenging. It's also quite challenging living a life of isolation without friends or support, and not having the chance to learn, change and grow beyond the catastrophic effects of a mental health challenge. This act means I can choose the path that suits me and my life goals, and make my future more hopeful. Thank you, Margaret Sweeney. Thank you very much for listening.
So I'm speechless, Margaret. That was absolutely fantastic. And what a beautifully written contribution. We're so grateful for your honesty and the depth of thought that you put into that. Thank you so much. I think some of the comments, people are saying they're quite moved by it. I'm quite moved by it. Thank you again. So
Okay.
yeah, that was beautiful. Thank you. Thank you for
Thank
that.
you. Thank you.
Okay. And again, I suppose just to say, you know, people's this act and the work that we're trying to do is about people's lives. This is real lives and the reality of people's lives. And I think that this is what we're trying to convey today, that this is not some kind of arbitrary act. It is about putting the person at the centre and ensuring that they remain at the centre in control of their lives. So to move on, we're moving now down to County Cork, to Bantry in West Cork, the beautiful Bantry, which I go to every year. And we're going to join Mary and Damien O'Donovan from their beautiful town of Bantry. Damien is a healthcare assistant in the West Lodge Hotel in Bantry and is a very keen GAA fan. While Mary is passionate about Damien's right to live the best life, his best life and their best life in their own community. So over to you, Mary and Damien. Thank you so much for joining us.
Thanks. Right. Can you hear us? We had trouble with our video earlier on. Can you hear us from this distance?
We can.
Yeah, okay.
My name is Damien O'Donovan. I'll tell you a bit about my life. I work as a pool attendant at West Lodge Hotel since 2012. I am a coach with Entrepreneurs GA 112 team. I have awards for Match of the Year twice. I have a few makers from Special Olympics. I was involved in GA Golf versus the Oxers, and I got an award for most popular actor. I have my bronze and silver and gold glacier award from the president. I am involved in Buckfox Cafe with my Bob Barry.
Thanks, Emma. Emma, who makes the decisions in your life?
I make my own choice.
Why so?
Which is my business.
Alibi. Tim is too modest to tell you that one of his medals is a world gold medal for swimming, and also that when he did his Gold Goshka, he raised over €6,000 for charity. That's just a flavour of Damien's life. Damien is very clear that this is his life and it's created by his decisions. He's an awesome human being. He's a great son. He's a very valued employee. He's got to go to work this afternoon. He had to swap his shifts from the morning until the afternoon. He's a great crack, especially after a few pints. He's a loyal and true friend. And amongst his other talents, he is a great decision maker. We've always operated on the basis that Damien has the ability to make his own decisions and that he would lead and direct his own life. And he developed a very effective strategy many, many years ago. When we'd ask him to something, to make a decision, he'd say, I'll think about that. And Damien thinks about it in his own good time. You might wait a few days or a few weeks. You might check in and say, Damien, did you think about that? Not yet. And you'll get the decision eventually. May not be the decision you want, but we trust that it's always the right decision for Damien. I know Damien really well, think I know him really well, but I don't really know Damien's feelings. I don't know what Damien feels. Only Damien knows what he feels. And he's got a real deep sense of himself. And he knows what's right for him. And why wouldn't he? I heard someone saying a long time ago that decision-making is like a muscle. It needs exercising to be fit for purpose. And Damien has an extremely well-developed decision-making muscle. Decisions come in all shapes and sizes. The daily decisions just happen. Damien runs his life completely independently, and a lot of other people's lives around him hinge on his decisions and his remembering things as well. But this act, I suppose, is more for us about the big decisions. And we had a bit of one of those decisions this year during the pandemic. So Damien was let go from the West Lodge early on in the hotel when they closed the leisure centre, when COVID-19 took off. And that was really a difficult time to be off work, and the GA was gone. So we all struggled in that space, and Damien struggled, as did the rest of us. So then when it became apparent that the West Lodge was going to open up again and Damien was going back to work, we were worried. Perhaps thought that maybe that was a bit of a risky environment for him to be going into, a hotel where there was tourists coming from different areas. And when we spoke to Damien about the possibility of perhaps maybe getting a job somewhere else, maybe going back to college and doing something different, he just wouldn't hear about it. He was very clear that he was going to go back to work. And that's what he did. And he was right. Ultimately, it's his life. He made that decision, and he was very clear. He wasn't entertaining anything else. He had a conviction that this was the right thing for him. And he was right. He went back to work, and everybody in that space has been absolutely fine. And could we have put a lot of pressure on Damien to try and make him do something different? We probably could have done. An awful lot of pressure. And would he have caved? Perhaps he would, but that wouldn't have been the right thing to do. I remember hearing somebody say quite some time ago, a gilded cage is still a cage. There's no point in us keeping Damien safe here at home when he wants to live his life. I certainly wouldn't be disagreeing with you, Anya, but I've stopped calling this the Assisted Decision-Making Act. I used to call it the Act of Emancipation, and now I call it the Capacity Act. So I worry sometimes that people are going to hear this about jumping in and assisting people to make a decision, although I know and respect absolutely and trust that that support is going to be there when it's needed. But for me, firstly, I hear about it being the presumption of capacity, unless proven otherwise. No longer are people guilty until they can prove their innocence. I was talking to a dad recently, and he talked about his son nearly being over the line. And I really struggled with that line. This line that says that now you're normal, but for some assessment or some condition, you've crossed the line into some other space where all of a sudden, all your capacity can automatically be up for question. I believe that this act should help to stop that line. I really struggle to articulate how profoundly important it is that Damien's personhood is never diminished by anyone. I love phrases like autonomy and self-determination, but they don't convey the feeling well enough. I was chatting to one of Damien's sisters last week, and I was asking her, how can I try and make people understand in this webinar how profoundly important it is that Damien makes his own decisions? And she said, Mom, it's very easy. We just want Damien to live his true life. His true life. And that's it. Just like us all, Damien's only going to travel this road once, and what an absolute tragedy if he never got to do it his way. Can I tell them about the under-12s match on Monday? Is that okay? So Damien coaches the under-12s. He's one of the coaches in the under-12s, and they lost the game on Monday evening. They lost it by a fair chunk. And Damien was really upset when he came home, and it was the following evening before he could tell me why he was so upset. The guys were really disappointed, and one of them started to cry. And Damien got so upset because you felt you couldn't go over to him. Why? Why couldn't you go over to him?
Because social distancing.
Social distancing. So this guy's empathy and courage and showing up every day of his life is just awesome. And that's Damien. That's Damien's way. That's the way he's developed his personality over his life. And by God, does he get social distancing, I tell you. My worry would be that sometime, for whatever reason, someone else might make a decision for Damien. A decision that doesn't fit with Damien's deep sense of himself. I don't pretend to know anything about the thousands of people who benefit from this act. But from our little corner of West Cork, my earnest wish is that those who guard the act have the time, respect, humility, and all the other attributes that they might need to fulfill the spirit of the act. Because I believe that this act should mean that even over my dead body, no one will make a decision for Damien that is not in keeping with his life, his true wishes and preferences, his way. I want to take this opportunity to thank the many, many people who have worked and continue to work so hard to effect the legislation, and I wish you all the very best with the implementation of this Act. As Damien says, he has the same rights as everybody. It's his life.
Nothing about me, not me.
Thank you.
Thank you so much.
Thank you so much, Mary and Damien and Mary. As usual, you're both so inspirational for us. And I remember being on a training course with you, Mary, a few years ago, and you said to me, we only have the one life. We only have the one life. And that's always stayed with me. And you said it again, Damien has the right to live his true life. And I think that, you know, that's a very simple message. And again, you're both just, your generosity of your story and sharing your life with us is so important, I think, to make this so real for people in terms of how important this Act is for people's lives. So thank you again so much. And Damien, thank you so much for taking the morning off. We really appreciate it. And I'm delighted that you got to go back to work, because I know how important that is to you. So well done. Thank you so much.
Thank you.
Thank you. Okay. Thanks a lot. So we're going to move on now, and we're going to go to Germany, where we're joined by the Shaler family. Are the Shalers with us? I think they are. So we have Pádraig, Reinhard and Pat are joining us from Germany, where Pádraig is making good recovery following surgery. Home is in Dublin, where Pádraig lives with Pat, who's a full-time carer, and Reinhard, who runs Unsail Foundation, and they'll say a little bit more about that. We're so pleased that you're able to join us today, particularly from Germany as well. So thank you so much, and over to yourselves.
Well, thank you very much, Kiva. So we're going to talk a little bit about our experiences, and especially Pádraig's experience with decision making. There was one occasion where a doctor told us, when I hear gallop, I think horse. When someone sees Pádraig with his eyes half closed, with little movement and no voice, they often think he can't hear, listen, read, understand, reason, or decide. Assumptions help us to understand the world around us, but they can also limit, and sometimes dangerously limit, our capacity to look a bit closer to see the zebra galloping down the savannah in Dublin Zoo, or to allow Pádraig an opportunity to live his life, to offer him inclusion, equality, participation, and self-determination.
Just we can give you so many examples of where Pádraig's presentation leads to people making certain decisions about him. One of the most striking ones for us happened when he was in the neuro ward in Beaumont Hospital. I'm going back now, this is about 6.5 years ago, following his accident. And we were standing at Pádraig's bedside, along with a nurse, 2 nurses and a healthcare assistant, when somebody asked, and what nursing home is Pádraig going to? And the question came, it was a bit of a shock to us, but we were asked, Reinhard and I were asked, Pádraig didn't come into it. But what was really striking was not even the question, it was the assumption that Pádraig was going to a nursing home. And as it happened, Pádraig didn't want to go to a nursing home, he wanted to go home. But it was such a momentous decision. This was, you've just finished college, and right, you're going to spend the rest of your life in a nursing home without any involvement or input of what his wishes were. And at the time when he was in hospital, Pádraig was able to open his mouth when the nurses were cleaning his teeth, open your mouth, so it was clear he could understand, he could hear well. And shortly afterwards, a nurse, the head nurse on the ward, mentioned to us that you could use his tongue. He can move his tongue from side to side. He mightn't blink, yes or no, but he could move his tongue. So it was clear at the time that he could make a basic decision like that if he had been helped. I mean, it was mentioned earlier on the need to train staff. And I think, yes, this definitely needs trained staff. I mean, we need a total culture change to see that just a lot of people who've had severe acquired brain injuries, they are still in a position to make decisions. Just taking it onto a more sort of daily level, these sort of assumptions that are made happened when we were going over to vote in the general election. That we were trying to get into the local school, which is semi-accessible, and a neighbour coming out said, "Oh, Pat, I'll stay here with Pádraig, and you go in and vote." And I said, "We're both going in to vote." And she was embarrassed at the time at what she said. And I mean, these are the same as the nurses in Beaumont, this neighbour. These are all very well-meaning people. But I mean, it is just that we're so conditioned when we see somebody disabled like that to assume that, right, we do everything for them, that they don't decide or do things for themselves.
One of the key words in the new act is assisted decision making. We have learned that this assistance must come from somebody who knows the person and well understands them, especially for those in similar situation to Pádraig's. Otherwise, big misunderstandings will happen, and here's another example.
It's more a light-hearted misunderstanding, but it's so easy to happen, and it shows when somebody doesn't know the person, doesn't understand their sense of humour, their feelings, their thoughts. It was a therapist who came in, and it was the time Trump, at his last election, was going up for election. And she said to Pádraig, "Do you like Trump?" And Pádraig has a bleep that he communicates with, and he gave one bleep, which means yes. She was a bit taken back because this didn't seem consistent with what she knew of his views. But then when Reinhardt asked him, "Do you like Trump's politics?" he gave a very clear no. Now, we knew what Pádraig was talking about because YouTube had his Trump's top 10 best moments, which Pádraig really liked to look at, and he liked looking at Trump when he found him funny and entertaining. But the question had to be asked. You had to be more specific to elicit the right answer. That's something with sort of the whole thing of assisted decision-making. I think it's fine that you do have maybe health workers assisting and court appointees, but I think fundamental is that it is somebody is there who understands the person, who knows this person well, and probably above all, somebody who genuinely has their best interests at heart.
Yeah, over time we have learned that Pádraig can not just understand but read, solve complex problems. He can read questions and using the same switcher, the bleeper, pick the correct answer. So he has 3 options like who wants to become a millionaire, and he can pick the right answer from a choice of answers. His sense of humor and language preferences have not changed. If you ask him to spell his name and you expect P followed by an A, you will learn that he prefers an A feather. He still likes Pat to speak to him in English, me to speak to him in German, and his friends elsewhere. We've learned that the biggest barrier for him to express himself and fully participate in conversations is our incapacity to provide him with the adequate means. That is why we are constantly on the lookout for new technologies, like this summer we found a handshoe mouse that fits into your hand really neatly and nicely, and you can now use not just one button but 3. And we are still experimenting with that. We have also come across some leading-edge research that translates cortical activity into text, or in other words, translating thoughts into speech.
Centrally to just the most fundamental of human rights is the right to self-determination and the right to be involved in sort of decision-making aspects of our society. I think it's been very encouraging to see in recent times how disabled people are being brought onto boards and committees and are becoming involved in decision-making bodies. And I think this Act will really help to consolidate that participation. But as well, I mean, public awareness has been mentioned a few times, but it is up to everybody, to all of us, that we have to question these and change our existing perceptions of people who can make decisions. These are sort of embedded attitudes, mindsets that have been there sort of for decades, for centuries, that people, and people like Pádraig with, and there are more of them now because they are surviving accidents, that people like Pádraig, a lot of these are very capable with assistance of making decisions.
For us as family members, the Act marks a radical step in the right direction. We look forward to Pádraig's participation and inclusion in his affairs, soon to be legally recognised in Ireland. We look forward to not having to fear that outside bodies or persons may take decisions against Pádraig's wishes, decisions which may not be in his best interest. It is a source of joy and relief to us that his decisions will finally be respected legally. Not only horses gallop, and not only those with a clear voice and their eyes wide open can hear, understand, read, reason, and decide. So no decision about Pádraig without Pádraig. Yeah, we have a...
Yeah.
No decision about you without me.
Thank you.
Thank you so much, Pádraig. Thank you for that. Thank you, Pat. Thank you, Reiner. Thank you so much for always supporting the work that we're doing, for being so open about your family, about Pádraig's story, Pádraig being so open about your story. It's these stories that change our lives and change our practice. And I really appreciate you taking the time today, because I know you're in Germany and I know that you're in hospital, or in a rehab hospital. So, like, from the bottom of my heart, I'm so thankful for the efforts that you made today. So thank you so much.
Thank you.
Thank you.
Congratulations.
Thank you.
Yep.
Okay, so that's our contribution. Now, Mary's sound is a little bit of background noise with Mary's sound, so just bear with us with it. We haven't yet worked out what's going on with Mary's computer. So Mary Donnelly, Professor Mary Donnelly, joins us from Cork City today. She's the chair of many committees relating to the Assisted Decision Making Act and the consent policy. Mary's written and advised on many policy issues relating to mental health law, decision-making capacity, the role of family in decision-making, among many other issues. And she's chaired all of the groups that have produced the draft healthcare codes and non-healthcare codes for the Assisted Decision Making Act. So we're delighted to have Mary here today. And Mary, you have a tough act to follow, tough 3 acts to follow. So thank you for taking the time to join us. Thank you.
Thank you very much, Caoimhe. I'm not even going to attempt to follow those acts. They were absolutely inspirational. It's a wonderful video, and yet I couldn't have thought the video could be bettered, and yet the presentations today have I think, moved and inspired everybody who has seen them. So thank you very much to the presenters, and congratulations to those who've made the video and all of the participants. It's a fantastic video. When I first looked at the video, which is now a number of months ago, I was really struck by how it put the human into human rights. And sometimes when we talk about human rights, it can seem like a very abstract concept, something that people talk about in books or theories, but actually something which doesn't have that kind of resonance, that human resonance. The video brought human resonance, but today's presentations brought even more human resonance. And I would hope very strongly that our political decision makers get to see today's presentation. And one of the things I'll be suggesting is that these presentations are made and sent to our political decision makers, because we still have a fight on our hands to get this act up and running. And I'm going to talk a little bit more about that. So the HSE was very prescient, I have to say, in 2016 in recognizing that how the HSE responds to this new piece of legislation is going to determine to a huge extent the success or failure of this legislation. There are, of course, many actors. We've seen Anya, and Anya's role and the role of the decision support service is obviously central. But for many people, the first line in which they will encounter issues relating to assisted decision making, the HSE's response will be really, really important. And this is something which the Office for Human Rights and Equality recognised and was supported, as Caoimhe noted, by Dr. Philip Crowley and the Quality Improvement Team. And since 2016, this group has been working very, very hard to develop policies and practices so that when the time comes, when the Act commences, we will be able to hit the ground running. Sometimes, for those of you who are looking on from outside, you may say, well, where are all these policies? Why aren't we seeing them? Are they doing anything? Well, actually, there's been a huge amount of work being done, but until we have the final sign-off on commencement of the Act, we can't really go public with a lot of these policies, simply because there may still be changes made to the legislation. We're expecting some changes to be made, and we're waiting until that has happened so that you can start to see the kind of work which has been done. It's absolutely crucial that everybody within the HSE, everybody, all health and social care professionals, buy into the potential of this Act. It is in some ways not a perfect Act. It has flaws, but its heart is in a very, very good place. And we saw that today. We saw that, as Damien put it, decision-making is a muscle. The more you use it, the stronger it gets. That is the mentality which underpins the Assisted Decision-Making Capacity Act. It is about facilitating people, encouraging people, ensuring people can use that muscle. We met 3 people today, all of whom use that muscle. And yet we saw, for all 3 of them, that they are facilitated by others. They are assisted in using that muscle. Margaret talked about her friends. She talked about her husband. She talked about her children. Mary and Damien are just a truly wonderful twosome. But we saw too that this isn't just Mary and Damien. This is Damien in his community. This is Damien making his decisions. The story about Damien going back to work is such a powerful story and so inspiring. Must be a good place to work, Damien, at the West Lodge Hotel. And then we saw Pat, Reinhardt, and Pádraig, and how incredibly powerful Pádraig's individuality and personality are, and how Pat and Reinhardt work with Pádraig to ensure that Pádraig can be, again to quote from Damien, can live his life, the life he has, in the best way for him. That's what this Act is about. But it would be naive to think that this Act is definitely, or rather I should say, we have been a long time waiting for this Act to come into force. We have been promised by government a commencement date of 2022. It is important to hold government to that promise. That requires that the DSS is properly funded. It also requires that we, and I mean everybody on this call today, make a bit of noise. Make it clear that we are not going to stand for the kind of inadequate, inappropriate, and inhumane legal system we have at the moment. Our legal system means that the only way in which decisions can be made where someone has capacity difficulties is through wardship. Wardship is a profoundly dehumanizing model. It has certainly been operated in a more appropriate way in recent years. Nonetheless, and it is quite shocking to remember this, it is grounded in the Lunacy Regulation Act of 1872. That is the current framework. We need to get away from this framework. We need to do it soon, and we need very, very strongly to maintain political pressure. This is a human rights issue. This is a human issue. This is an issue which matters profoundly to people like Pádraig, like Damien, like Margaret, like the other participants in the video, and like all of us, because we will all of us at some point encounter this act. But this service needs to be funded, the DSS needs appropriate funding, and government needs to be pressurised. So I suppose my final point on this is a wonderful, wonderful video. These are wonderful, wonderful people, but we need to make sure to use all our resources to ensure this act gets up and running, and that when it does, we are able to make life as positive as possible for all of the individuals in this state, for all of our citizens. Thank you very much, Kayla.
Thank you, Mary, and thank you for those really helpful words. Mary, if you could just mute yourself there. Thank you. Thanks. Great. So as you can see, we have come a long way, and I think there are people who've joined us today, many people who've joined us today, who have been working for many years to try and keep the person at the centre. There's services all over the country who believe this, who breathe this, who use this, who work with this kind of way. Our challenge is that this becomes the norm. This has become the way that we do things. So I suppose just to say to you, the purpose of our office is to keep the pressure up, to work with Anya's team, to work with our staff, to ensure that the principles of this Act, irrespective of commencement, become a core part of what we do. And that we ask those questions across every single service. Where is the person in that? How have you ascertained their will and preference, even if they can't communicate that to you? So these are principles that we continue to keep at the heart of what we do. And we can't do this alone. I think Mary has very clearly set out that this needs a village behind it. It needs an even bigger village behind that then, in order to get a groundswell of support. And I think we have been, over the last 3 or 4 years, have managed to build quite a big community within health and with outside, in terms of the communities that support this, and will continue to do so. Before we finish up, there's a few things. There's a few people I want to again thank. So we heard from 3 groups there that were involved in the video. There was many other voices. You saw that there was at least 18 people that participated, and we would have loved to been able to have everybody on it, but we just didn't have time today. But I think their story stands for itself. You saw Claire Hendrick was in the papers this week, speaking about her experience. Claire, I think, has joined us today, and again, thank you so much, Claire, for continuing to lobby in terms of those issues. And all of the people, again, from all over the country that gave us their time and gave us and honestly and openly spoke from their hearts. There's 3 people in particular that I want to single out whose idea this was. Deirdre Ryan has joined us today. Carol McNamara, I'm not sure if Carol is with us. Carol retired from the HSE a couple of years ago, and then our colleague Angela Teisel, who can't be with us today due to a family bereavement. But those 3 people, it was their idea, and they pulled the work together. Myself and Jacqueline then took it over once all the donkey work was done, and then tried to bring it to you today. So we're deeply grateful for their thoughts and for the work that they put in. And And finally, I suppose what I'd encourage all of you that have watched this to share it. You don't need our permission. And also to share the link from today. I think the 3 stories, as Mary has said. So not only do we have the rich and beautiful material in the video itself, but we have 3 more stories that were shared today that were really quite profound, and I think are a great lesson to people in terms of what this means for people, and what autonomy means for a person in terms of keeping them at the centre. We have quite a number of questions that have come in. We will address them separately, and also just to say, we have a number of additional webinars coming up in the next few weeks. Many of you are on our mailing list, so you'll know about those coming up. So we've got one coming up on the 8th of October in relation to advocacy, particularly in the time of COVID. We have another one then on tools to support decision making, and we might link in with you again, Reiner, in terms of some of those technologies that you were showing us. I think they're very relevant to people because people don't always know about what's available to support somebody. I just see a question then, the link to to get to the video, you go to www.assisteddecisionmaking.ie, and all of our details are there, including the link to the video today. If you have any difficulties in accessing any of the details, just feel free to contact us, Jacqueline.Grogan@HSE, Orla.Brannigan@hse.ie, and the details will be in the chat box. So thank you all for staying with us. I registered, there was over 717 people joined us from all over the country, and then people will be able to link in with this afterwards. So we wish you the best for the rest of the day. Stay safe, wash your hands, wear your mask, keep your distance, and thank you so much for joining us. Thank you.